surgery day. It's surgery morning, so here we are at the hospital, getting ready to go down to the surgery area. I have all my paperwork, and I'm nervous. Good morning. It's Thursday morning. I almost said February 13th, the day before Valentine's Day. And I'm just waiting for my cousin Jan to pick me up. Everything went really well. The doctor joked with me and said, "Did you even have surgery?" Because I did so well that the nurses couldn't believe it. I didn't need any pain medicine after 7 p.m. yesterday, and I've been drinking, and peeing apparently is very important, and all of those things went good, so I'm so happy. Actually, my C-section was a lot more difficult than this. So just waiting to get discharged. I have to prove that Jan is going to be with me for 24 hours. Well, not prove, but they want to see her. They have to know that I'm actually leaving with a person, so I will take her back there and show her to the nurse, and then I get to go back to Jan and Mitch's place and recover, which is always a great place to be because they're lovely people. Stay tuned for day 1 post-op. Hey everybody, it's day 1 post-surgically, and I'm back at my cousin's place, Mitch and Jan. Jan was kind enough to come and get me this morning from the hospital, and I'm back at their place, and I had to get out of I wore these stupid track pants, and I thought that was a good choice because I thought they were comfortable clothes, but turns out all my scars wounds, I guess, instead of scars. I'll be scars later. All my wounds are right where the waistband of these damn pants is, and I just couldn't take it. So when I got home, I changed into just a nightgown and a robe, and struggling a little bit today with trying to get some protein in and hydrate at the same time. I got some pills from the doctor. One was a pain medication, and it's a big pill, so I'm thinking I might have to, I don't know if I have to crush it or what I have to do with it, but I'm kind of afraid to take it like that. And the other was some kind of stool softener, and that luckily was a little gel cap, so I wasn't too worried about that one. But these other ones, I've put a call into the dietitians at the bariatric clinic at the Victoria Hospital just to see if they can answer my questions about that. What can I say? I don't have a lot of pain, which is really nice, but I am having trouble getting on and off the bed, and getting up and down, sitting and getting up. Really though, my C-section was worse than this. My C-section was way worse than this. I guess because you have a huge incision when you have a C-section. Let's face it, a huge incision, and they're pulling this baby out of you, and whereas in this they're doing invasive things, but not to the same extent perhaps. So just waiting to hear back from those dietitians to get a little bit more advice about what to do about those pills. And I did check in with or I should say they checked in with me, my dietitians in Montreal. So I reached out to them and had said, I have a couple questions about this. And they just said, you should follow your surgeon's advice. And I'm going to go upstairs right now and make myself some milk and protein powder. And I'm going to put a little bit of psyllium fiber in it to sort of keep things moving. This morning when I got home, I made some broth and I put some Boost protein powder in it, and it all clumped up. It was horrible. So that was a fail, a big time fail. I had some protein powder at the hospital yesterday that was completely different and mixed in pretty good with my hot broth, but this was not the case with this Boost. So and it's not mixed Boost, it's just Boost protein powder. It doesn't have any flavor. So she suggested I try it in the cold milk instead. She felt that might be a better solution. So I'm about to go upstairs and whip myself up something. I'm sure it's going to be really delicious. Haha. My goals today, though, are just to stay hydrated and try to get as much protein into me as possible. And, when I hear from the dietitians, hopefully then I'll have a little bit more information. I still can't have a shower yet, so I'm looking a little bit rough around the edges. I had a rough night in the hospital. I didn't sleep much at all, maybe an hour or two. It's a noisy place. There's bells and whistles going off, and, people making other patients that are not as considerate, or just sick people that can't help the way things are, which you can't entirely blame them for. I will say the staff was absolutely fantastic. Shout out to the Victoria General Hospital, because it was amazing. Everybody that I encountered did a wonderful job, and I really felt I was very well cared for. So I'm very appreciative of that. That's it for now. Gonna walk up the stairs, make my protein shake, and maybe come and just sit down in my room here. I've got a nice little room that Jan's fixed up for me so that I can have some privacy and a place to rest until I get my phone call, and that'll be that. I'll check in with you again tomorrow and let you know what's going on. Maybe I'll even show you my incisions tomorrow. I get to take my bandages off them, so maybe I'll film while I do that. Ooh, you'll get to see my belly. Exciting. All right, later.